Hey, Nurse Key here, and I help new nurses get clear on their skills, competent in their career, and try to prevent burnout, right? Because we don't have a nursing shortage problem, we have a nurse retention problem. So, welcome to the New Nurse Bootcamp. Let's get into it. Today, I want to talk about crash carts. Now, we always see these on the unit, and most of the time we never even see what was in them until actual code happens. And maybe that's a little bit backwards. So can we break it down to see what a crash cart is for, how do we use it, and what's actually inside? Okay, let's get into it. Okay, so we know a crash cart is obviously it's in a critical time of need. It's life-saving measures and it has medications in them. You should locate your crash cart on your unit as soon as possible, if not within the first few minutes of your once you get onto the unit. So it's most always red. It's going to be at the corners of each unit, like in the hallways. And most units or facilities have 2 per unit. So what does it actually include? So we'll talk about the defibrillator, which is an AED as well. A defibrillator or AED is like interchangeable. Medications, life-saving medications, intubation trays if they need to be intubated, where it's like their airway is compromised, or they can't breathe in, or they can't breathe on their own. Airway supplies for that process, IV supplies if we have to get IV access, suction equipment if it possibly was aspiration or something is in their airway, PPE to gown up for these procedures, a backboard for effective compressions, and then a portable suction, usually at the bottom and or at the top of the cart, and the emergency surgical supplies. All right, so again, why do we use crash carts? It's to save a life, to boost our confidence in our skills, so we have like a standardized procedure. It helps us to have teamwork, so everybody has a role, and then it also improves patient safety. So when do we actually use a crash cart? Now, we may not use all of the features on a crash cart, but we have, depending on the situation, we're going to utilize certain supplies. So if it's a cardiac arrest where somebody's heart is stopped, that's what we call code blue. Respiratory arrest where their lungs stop breathing, or they stop breathing, or their airway is compromised. Severe bradycardic or tachycardic, which is a very low heart rate, which means it's under 60, and a very high heart rate, which is over 100 to 120, and there's different levels to the heart rate. And then shock, which could be like hemodynamic shock, which is like a loss of blood volume, different levels of shock, and then respiratory distress or airway emergencies. Also, allergic reactions if we need an EpiPen, drug overdose, which may like reduce your respiratory drive, acute neural symptoms. All right, so the drawers, the most important part. The top of the cart, like I said, they have an AED or the defibrillator. We know this as the machine that will shock, right? And that's generally to shock your heart rate back into the right rhythm. There's only certain rhythms that you